All right. We'll see if anybody shows up today. If not, we're just going to have a good discussion on senior health in dogs and cats. So dogs and cats are living super long these days. I've been practicing as a small animal general practitioner for 15 years. And it amazes me how now on a regular basis, I see dogs and cats well into their teens, even some into their 20s. I have a little poodle right now that we're doing senior care on that is, hey there, Sarah, BB. He's probably 20, I think he's 20 years old. And he comes in every week and gets his laser therapy. And we got him on special diet. We got him on all the nutraceuticals and all that stuff. So seniors are becoming a really big part of veterinary medicine and care and lectures and special considerations for senior pets are really starting to take off. So we're going to talk about that today and answer questions hopefully you guys have on that. We can certainly talk nutrition. We always talk nutrition, and there's definitely some gaps in that and difficulties in that. So we'll kind of try to hit some of the high points in that. And so I guess I want to start out. Do you have any questions specifically, Sarah? Or are you just here for the ride? You guys have questions, definitely in the chat, and I'll try to look in the chat. And then, like, if you super chat or something, I'll be able to see it easier and all that stuff. So I will really try to focus on that if you guys do that so that I don't miss your question. Otherwise, I kind of have in my head a couple things that I want to talk about. But yeah, go ahead and ask your question, and then we'll get into kind of what I had planned, and then I'll answer. I'll answer questions as we go. And I don't have it on slow mode, so I should be able to see your questions real time. And like I said, if it gets too fast and I miss a question or a super chat or something, let me know and I'll circle back to it. There's 3 of you guys here now, so that's awesome. If you can like and share, that would be great, so we can help other people find it, because people tell me all the time they didn't realize that we were having a live, even though I try to put it on all the platforms and all that stuff. So if you could hit the like button and share, that would be great. Wondering if you know why many senior diets actually contain more calcium versus the regular. The companies have told me seniors need the extra calcium for their bones. I guess I would ask you what companies have told you that, because that's silly. The bones are already there, so they don't need calcium for the bones because the bones are already developed. So that doesn't physiologically make any sense. So this is my theory on that. And actually, I was going to talk a little bit about that today as well. So let's start at the beginning with what are the nutritional guidelines, because that goes back to that question, like which companies told you that. I know which companies probably didn't tell you that. And those are the companies that follow the data that we follow on this channel, which is the small animal clinical nutrition data. Small animal clinical nutrition gets their data from the research that they do. And they also take data from other research companies, and they take data from the NRC, and all those references are in the back of that textbook, so that if you want to check out the references, you can, but that's kind of like the reference that compiles the reference. And then I have taken compilation of that reference and then referenced it in my workbooks. And so I'm going to use these workbooks for not the top companies, not from Royal Canin or Health. Yeah, exactly. So they're totally making that up. That's not true. And if any company tells you something like that doesn't make any sense, ask them where they're getting their data and ask them for the papers that substantiate that. I know for a fact on the Carnivore website, they say something like, if your dog, and we put a lot of calcium and minerals in ours, but that's okay because the calcium is just stored in the blood, and if they don't need it, they don't need it. And that's absolutely not true. It's so far from the truth. I don't even know how they can get away with putting that on their website, because it is so not true. So either they know it's not true, or their veterinary team is so bad, they are saying things that they believe is true that is completely false. And so any company that tells you something like that, I would be suspect that they're either lying or they have no idea what they're talking about, and they don't have any business giving you that information. So ask them why they're saying that, because that's not true from a veterinary standpoint, and it's certainly not true from a nutritional standpoint. So seniors, let's review it really quick for the dog, and I'm gonna thumb through. Got a nice chart here that goes over all the life stages. So when they're a puppy, they need a lot more calcium and a lot more phosphorus because they are forming bone. They're growing very rapidly. They're putting bone down. Regular sized puppies need more than a large breed puppy, because a large breed puppy, we don't want the bone to go down so fast because they're going to get brittle and they're going to get growing pains. So they actually need higher calcium and phosphorus levels, up to 1.7 for the calcium and 1.3 for the phosphorus. So the calcium and phosphorus, if you're into the ratio thing, a lot of people look at the ratios and 1 to 1 to 1 to I think 1.2 or something like that or 2.1. I can't remember. I don't really look at the ratio. The absolute's more important, because the ratio can be anything. You can have magnitudes and magnitudes and magnitudes that are over, and the ratio still be correct. So I don't really look at the ratio. But the puppy, the regular size puppy, is going to be higher than the large breed, which is slightly smaller. And then the adult, it drops down just a little bit more. So 1.2 max to 1. And then the senior ideally drops down to 0.75. So quite a bit of a big drop there for the calcium. And it drops from 1.3 as a puppy down to 0.7% in the dog. Cat is different as well. So cat, as I reference my reference here, you go from 1.6, so even higher than the dog for the cat, calcium, 1.4 of phosphorus, and you drop down to 1 for the calcium and 0.7 for the phosphorus for the cat. So there's quite a big difference between an optimized level for your seniors. And the reason being is they aren't utilizing it. They're not putting it down in the bone. And so what happens, the body has to process that. It has to get rid of it, and it has to get rid of it through the organs. And if we're asking old organs, if we're asking the organs to do that, they're having to work and they're already older, and so you can get overworking. So it's just really not necessary, and we know that they do well optimally based on the research on those lower levels. So why do the companies put extra in there? Because it's a business plan. It's a business model. And so if a company they have these numbers, and even Hills and even Royal Canin that know what the best numbers are, you'll find that a lot of their senior diets a lot of them don't make it. They don't get there. So why is that? There's a magnitude of factors, and it boils down to economics a lot of times. So we can have a whole Q&A on veterinary economics, and I think that would be an interesting one for the lay person to try to understand why things are priced the way they are, or why certain services aren't offered in certain places. But if it costs an exorbitant amount of money for the company to get the calcium and phosphorus levels that low and still balance all the other things that legally they have to balance, and it makes that food so expensive that they outprice the majority of their market, they can't cover their expenses, and they can't meet the bottom dollar that they need to meet to satisfy their investors and to even have a company at all, then they can't do it. They can't make that food, because then the whole company would go over, and all the good that they've done and all the research that they've done, it's just not sustainable. So I think a lot of companies have to make that decision. A lot of them get really close, and I think that's how you can pick the good companies. There are a lot of companies, okay, we want to say a senior 0.75 calcium, and they get it to 0.9. That's better than a lot of them where we see these companies where it's 2.4, 2.6. It's ridiculous. They didn't even try. And so they just slap the name senior on there because they can, and they sell the bag of food, and that's all they care about. And so I think that's a really important way to judge a company that is trying to do good but still balance the necessity of being a business. And so, they put the extra calcium and phosphorus because it just may not be attainable in their business model to get it as low as they wanted to. Or you have these companies that fixate on ingredients. And that is another thing. Fixate on these ingredients. High meat, meat is magic, meat. It's just not possible. Just can't do it. Just physically can't get it down because of the ingredients they've chosen, and they've favored ingredients over the balance. So that's kind of my answer there. Senior dogs need adequate calcium to support bone health, especially since aging can lead to bone weakening, and the body may pull calcium from bones if intake is insufficient. Right, but we already know that the optimized levels, the intake isn't insufficient, so that's a moot point. You have to know the bottom level to know what insufficient is. So if the bottom level is 0.75%, as long as you're at 0.75%, then it's not deficient. It's going to be like 0.3, or something like that. So yeah, that's totally bogus. They're just counting on you guys not knowing those numbers. They're banking on you guys not being informed. Yeah, and they contain more calcium than the regular because a lot of senior diets are an afterthought. They've just taken another diet and threw some glucosamine in it and said, hey, it's a senior diet, and they slapped that name on it. There's no senior requirements. You guys know that. ACO doesn't have a designation for senior, so they can do whatever they want. So Ronnie wants to know, when do you need to switch to a senior formula for a dog? Depends on a lot of factors. Depends on the breed, depends on their blood work. It depends on if you actually know the age of your dog. So a lot of people adopt their dogs now, so that's totally a guess. I had the other day in the span of an appointment, I went in and the lady was like, oh my gosh, my dog is so old. My dog is 17 years old. It's crazy. Does she look 17? And I'm like, no, it doesn't look 17. You've done a great job. How long have you had her? Have you had her all 17 years? She's like, no, I found her at the 7-Eleven 2 years ago. Well, then how do you know that she's 17? So it was like totally made up. So it depends on a lot of things. Some dogs are younger and they have some issues that are, some changes in their blood work parameters and stuff. And we'll say, well, you might be better off on a senior diet. They may have some joint issues, and we may say, you do better on a diet that's for seniors because it has some glucosamine added. They may need a lower fat diet. Senior diets tend to be lower in fat. So there's a lot that goes into that question. In general, I consider a normal dog a senior at the age of 7 and like geriatric after 10. Larger breed dogs like your Mastiffs and your Great Danes, I'm going to consider them a senior probably at about 5. So yeah, that's what I would say about that. On the lines of like seniors and senior health and things that I would like to share with you guys that I think are important. Definitely your yearly exams or even twice a year exams on your seniors, because things change really quickly. And when you go into those appointments, the blood work is really important. Almost as important as the actual exam itself, because there are a lot of things that happen in the background, and without knowing those numbers, we can't do some of the fine tailoring and fine tuning that you guys are asking about. So a lot of people will come in every year for their annual, which is great. They're there, they're doing it. But then, we'll say, at least at my clinic, we recommend blood work on everybody, even the young ones, because we don't want to miss anything. But especially the senior ones, because I can't tell you the number of times that we haven't seen a pet maybe in 4 or 5 years, and they come in and the pet is a limp noodle. They bring this limp noodle in. Oh yeah, sorry, Ed, I did say I would recognize Happy National Cat Day. Yes, Happy National Cat Day to everybody. I hope you are celebrating and having the most perfect day. So there you go on that. But anyway, they come in and they say, I don't know what happened. Oh my gosh, they've been healthy their whole life. I didn't see this coming. They've been so healthy. We've never had any problems. And we do blood work, and it's obvious based on the blood work, because we can tell based on blood work and the electrolyte shifts and things like that how long something's been going on. And the cat's been in chronic renal failure. And so for the past 2 or 3 years, The cat has not been fine. The cat has been slowly declining. Things have been getting out of whack, and it's been hiding it. It's been compensating for it. It's been trucking along. And everybody thought everything was fine because ignorance is bliss, and the cat has not been fine. And if we had caught that problem, if we had started catching those shifts 2, 3, 4 years ago, we could have actually slowed the progression and probably saved the pet's life. And this is not like a random occurrence. This is all the time. They've been healthy their whole life. I haven't seen you in a couple of years because they've been so healthy, and they haven't. Because we don't know if we don't check. They don't talk. They don't tell us, these type of things. And so the blood work is really important. The physical exam is important. What are some of the things that we specifically look at on physical exam for our seniors? The eyes obviously is going to be, major. Our senior dogs and cats do get vision impairment, and a lot of you guys will notice the eye color changing, and it'll get like a haze or like a film or like a blueness to it. And a lot of people think that that's cataracts, and they'll come in and they'll say, "Gee, doc, I think they're getting cataracts." And a lot of times it's actually not cataracts. So cataracts is a crystallization. Yeah, 15 years old, recently totally blind and deaf. Yeah. And we're going to talk about that and how that impacts their quality of life. So cataracts is crystallization, and that's where the actual lens starts to solidify in crystals. You can see the crystals in the lens. What a lot of times you guys are seeing, and we'll look with the light and we'll be able to see it. It can be a little bit hard with cataracts. Sometimes you have to dilate the eye or go to an ophthalmologist for this to use a special scope. That changing that blue color, if the lens is not crystallized, that's called lenticular sclerosis, which is, or nuclear sclerosis, which is a natural color change to the eye itself. And so it doesn't really affect their vision. It looks like it does, but it doesn't. They can still see. If they do develop cataracts or they develop sudden blindness, that is something you want to mention. Your vet will obviously be able to tell the cataracts. Blindness might be a little bit difficult, or vision loss may be a little bit difficult for them to, old age thing. Yeah, that's going to be lenticular sclerosis, the haze thing. So they should still be able to see with that. If they have blindness, that can be something can be worked up. So you want to make sure that if they have a sudden blindness or you feel like they've gone blind, there are certain things that we need to do. We do need to do the light exam to check for cataracts. We need to check the pressure in the eye for glaucoma, because glaucoma, you can't tell by looking at the eye. You can't tell if they have glaucoma. You got to use a special tool to test for glaucoma. Test the pressure in the eye, because the glaucoma will cause blindness. It's also a very painful condition, and a lot of people don't realize it's painful because all the dogs do is they start slowing down, or maybe hiding, or not wanting to come out so much, because the light and the pressure in the eye is just like a chronic, dull headache all the time. And so it's a really subtle thing, but it's a major quality of life issue. So you want to have the pressures checked. You want to have the blood pressure checked too, because especially in cats, as they get older, and this is, again, another thing that people come in, they don't come in because they don't realize the cat's slowing down or not eating. They don't know the cat has chronic kidney disease. They haven't been in for 5, 6, 7, 8, 9, 10 years. And all this time, the cat's getting kidney disease, and they're getting blood pressure spikes from the kidney disease. And one day that blood pressure spikes so high, it causes retinal detachment. They bring the cat in because the eyes are dilated crazy and they can't see. And we see that, and we notice retinal detachment, and they're like, "Oh my gosh, let's check the blood pressure. Blood pressure is over 200. And we backtrack to find out the cat has been in chronic renal failure for 2 or 3 years, and now they're blind and we can't do anything about it. So you need to have pressure checked. You need to have the blood pressure checked. You need to have checked for cataracts. And then if you do just have lenticular sclerosis, Sarah, you can ask your vet about OcuGlow. It's a supplement. And recently learned about it in conference this year. It's a lot of promise. Don't need a prescription for it, I don't think. But the ophthalmologists are really recommending OcuGlow for vision impairment related to senior pets, as well as cataracts. OcuGlow, it's spelled weird, OCUGLO, OcuGlow, I believe. Let me Google it really quick on another screen. Yeah. They have their own, I think you can get it on Amazon. I'm looking it up really quick. I don't carry it at my clinic because you can get it cheaper online. Yeah, OcuGlow Vision. Yeah, it's a green box, a green bottle. There might be some fakies out there, so you want to get the name brand one. But it's OCU-GLO. Can I type it in the chat? Oh, I can. There you go. If I can link it somehow, like if I can do like one of those things where I tag it in the description box or whatever, I'll see if I can add a tag for it since it's on Amazon. So that's what I would say. One of the first things, because when I do my physical exam, I do like top, front to back. We do it the same like every time. So I'll look at the eyes. Then, of course, the teeth is major in seniors. A lot of senior pets have horrible dental disease. Again, something that maybe has been put off. And then the problem is people realize when their dog is 10 that the teeth are really, really bad and a major source of infection, which you don't want to have. People don't realize that that's infection. It's a highly vascular area. That bacteria is going to your dog's heart. It's going to their kidneys. It's going to all the organs. And so by the time the teeth are really, really nasty at 10, what is the first thing that people tell me when I tell them? How many want to guess what I say? Your 10-year-old dog needs dental work. What do people say? They say they're scared of anesthesia because their dog is old. But, you know, it's like we've put these things off until it has to get done now. And it's a major issue. I have a whole series on dentistry. I know a lot of you guys that are here in the chat, which there are a ton of you in the chat, and not a ton of you have said hi. So you guys should say hi so that we know you're here. But the dental, I explain a lot about dentistry and the precautions that are taken in anesthesia and how veterinary medicine these days, at least at my clinic, can't speak to all clinics. Not all clinics are the same. Not all veterinarians are the same. Not everybody's expertise is the same. Not all the equipment's the same. Not all staffing is the same. But I can speak for me, and I think in general, anesthesia has gotten so safe and advanced in pets. It's not really even. It's like barely even a thought. Because it's so minimally invasive that, you know, we think about it. Obviously, we consider it, we weigh it, but we can choose, like, for pretty much any ailment your pet has, we can choose an anesthetic that is going to be like optimized for them. And so the risks of anesthesia almost never, ever, unless your dog has like congestive heart failure, is diabetic, and, you know, only has one kidney, like there's probably no reason why they can't get the dental work done. It's going to far make their life better than having the nasty teeth, because what will happen is your dog, as it gets older, it will develop these comorbidities, and then it'll be Christmas morning and they will develop a big swelling here. And you will tell yourself that it is a bug bite, and you will give a Benadryl, and it won't go away, and the eye will start weeping. And you will finally get to the vet after the holiday, and you will find out that it is a giant tooth root abscess. And then you have to do surgery, and now your pet is sick. So now your senior pet, you were already scared about anesthesia. Several days have gone by now with a major abscess, and they have to have anesthesia, and it has to get done because there's nothing else that's going to stop that. And it's going to bust open. They're going to have a giant wound under their face of weeping pus. So don't mean to scare you guys, but these are true stories. We see them all the time. This is not like an anecdotal thing. This is like common. You can ask any veterinarian. This is like common stuff that we see. Yeah. And sometimes you don't know. I mean, sometimes you just don't know. It just pops up. I've seen, you know, my videos, you guys know the dental diseases in the bone. You have to get dental x-rays done to be able to see them. So you don't always see them. I'm just talking about the ones that like put off this senior care. I think that as dogs get older, they need to go to the vet less, or they need less vaccines, or they need less, and they need less. Or the common thing is they're so old, I don't want to do too much. It's actually the opposite. As your dogs get older, you have to do more to keep them going if you want that longevity. So that's the teeth. You got to pay attention to the teeth. You got to get that dental work done. If you can get it done regularly, it's going to make it so much easier as your dog gets to senior. If you start cleaning them early versus we've had no dental care done for 10 years, or you have 10 years of tartar, we have to scale up. That's going to make your anesthetic longer. So that is a maintenance issue. Ears. A lot of people ask me about ears. They have lost their hearing. Unfortunately, there's not a lot that we can do about that. There aren't any supplements or anything like that for hearing loss. If your dog has suffered with chronic ear infections their entire life because they're a lab or they're a beagle, or they're, any of those really heavy, houndy type ear dogs, and they've had repeated ear infections, unfortunately, you're going to get some hearing loss. 12-year-old lab had surgery yesterday for cancer. And of course, I was concerned about the anesthesia, but a surgeon is board certified and they do all the surgery. So I felt comfortable. Yeah. Yep. Because board certified surgeons usually are working with board certified anesthesiologists. So I'm glad the surgery went well. But yeah, it can be done right. It can be done right and extremely, extremely, extremely safely, where the benefits far outweigh what we consider minuscule risks now for anesthesia for our patients. We don't do, back in the day, the anesthetics that were used were bad. The dogs threw up. They were super sedate. They took hours to wake up. Now we do anesthesia. We give an injection, reverse the anesthesia. They're up within minutes. So it's totally different ballpark. If you guys saw the amount of equipment and machines that we hook up. In my clinic, we usually have 1 or 2 nurses dedicated to your pet's anesthesia monitoring the whole time. One is doing the anesthesia. The other one is charting the anesthesia. So a lot of times they're like double teaming it. Your dog is hooked up to a 4-lead ECG with a central 5-lead ECG, actually, because it's got a central one too. A capnograph, which measures your pet's CO2 and breath so that we make sure that they're breathing properly. Thermoregulating water circulating heating pad, a thermometer, a pulse oximeter, and also a Doppler, esophageal Doppler, so that we can actually physically hear the heart. And if anything looks out of whack, both the nurses have stethoscopes and they're listening, and they'll say, wait a minute, I need to get a manual check. Something doesn't look right, or something seems off, or these numbers are changing too much. And so like the anesthetic monitoring is, at least in my clinic, like is sometimes impeding what I'm doing because there's so many cords and wires everywhere. I'm like, can we move this one a little bit? Or we're going to have to do this thermometer like in the back end because I can't get in here. So, if you have questions about that, definitely ask to ease your mind so that they can tell you all the wonderful things that they have, because those are the things that people don't realize, and why things are expensive at certain clinics and versus other clinics. Again, this veterinary economics. We love to share that stuff with you, because that is why sometimes surgery and stuff are expensive, because you have no idea the amount of equipment sometimes in the background that we're using to make sure that things are exceedingly safe. You would like to know from my experience the quality of life of a blind and deaf senior actually has. Yeah, so that's a major thing that a lot of the behaviorists and the behavioral specialists that I listened to this year at AVMA were talking about specifically was blindness and deafness, and how it affects the behavior and the quality of life of our senior pets. And it definitely plays a role. A lot of these guys, as they become blind and deaf, you'll start to develop or see behavioral issues. So a really common thing that people tell me almost on a daily basis, because I see seniors every day, is, gee, doc, is there anything you can do? They're like keeping me up all night long. They get up in the middle of the night and they just pace and pace and pace, and they keep me up. And they just don't seem to be able to get comfortable. They sleep during the day, but they pace at night and they get disoriented. And they do that because they have lost a lot of their senses, their vision and their hearing. And when an animal loses those senses, it can be disorienting to them. So there's things that you can do to help them. There are pharmaceuticals that you can use, and there are over-the-counter things that you can use as well if your pet is having an issue. Now, if they're blind or deaf and they're getting around fine and you don't change your furniture and they just truck around, be careful with swimming pools. I have had senior pets fall into swimming pools and have to come to me for almost drowning. Same thing out where I live, there's a lot of lakes. They wander off and they go into the lake. So you need to make sure that all that is secure, just like you would a child. Baby gates are really great for senior pets to block off areas that they shouldn't be. But if they're in the house and they're safe and they're just doing that disorienting thing because they're starting to lose their senses, there are definitely pharmaceutical grade medications that we can use. There are herbal medications. My integrative doctor uses one called Shen Calmer, and there's specific indications. Don't go online and order it. There are specific things you would use it for and wouldn't use it for. Sometimes you can use melatonin. Again, check with your vet if your pet's a candidate for melatonin. So there's a lot of things that we can do for senior pets to make them more comfortable if they're losing their vision and their hearing and they're up at night because they're scared because they can't place things anymore because their vision and their hearing is gone. Yeah, she's confused. Mm-hmm. Yeah, walks off and falls. Yeah, so you have to be careful with that kind of stuff. You might want to look in. I don't know how big your dog is. Oh, my Roomba is going crazy today. It's like been out like 17 times. Must have a dirty house today. Can you guys hear that, or should I try to turn it off? She's 8 pounds, so she's small. So you might be able to get one of those baby things that people use, like the bassinet things that you can put on the side of your bed. You can try one of those things. They make like these little bassinet things that you can hook to the side of your bed. It keeps you from rolling like over on your baby, but you could, at 8 pounds, you probably, because that's the size of a newborn, you could probably do that. Look into that. So that's the ears. So then after I do the head, and obviously I check all the lymph nodes to make sure I don't see any enlarged lymph nodes. If they have bad teeth or something, there may be some lymph nodes enlarged. So I check all the lymph nodes. Then we get to the heart. Really common, as dogs age, they will get heart disease. Cats as well. Cats is really hard. I've started to incorporate in all my anesthetics, as we're talking about anesthetic safety, really started to incorporate in all my anesthetics for cats. Any cat that is over like the age of 1 or 2 that comes in for an anesthetic, for me, I am requiring a pro-BNP test. The reason for that is back in the day, and I'm saying back in the day, and I've only been practicing 15 years, but I'm saying back in the day, a cat would pass away from anesthesia. You know, you guys are like, oh my gosh, people tell me, oh my God, I had a cat once that died under anesthesia in like 1998 or something like that. Yeah, because we didn't have what we have now. So now we have tests like pro-BNP. So cats that will have heart disease and undetectable with auscultation, you won't hear a heart murmur. They'll have heart disease. They go under anesthesia, and everything obviously affects the heart with anesthesia. And so with that undetected underlying heart disease, they would die, and then the owner would be forever scarred with their cat died under anesthesia and never want to do anesthesia again. Well, now we can do a pro-BNP, which is a simple blood test. And we can know right then, it's a point of care test. We do it and we have the results like in 10 minutes. If your cat has elevated cardiac enzymes, which would indicate underlying heart disease, it does not preclude you from doing the anesthesia. It's just more information. And if I get an elevated pro-BNP, I will always give the owner the option, because I've already examined the pet and physically I feel like they're okay. But now they're there that morning, I'm doing the pre-anesthetic blood work and I'm reevaluating. If they have that elevated pro-BNP, I can tell the owners, look, I did my physical exam. They're breathing fine. They're auscultating fine. All their numbers look fine. We did detect some underlying heart disease. I am recommending a echocardiogram. Those are expensive, $400 or $500. They may or may not be able to do that. They may say, look, doc, I don't have the $400 to $500. In your judgment, can we proceed with anesthesia? And then that will be my judgment to tweak the anesthesia and decide whether or not, this happened just recently. Actually, I had a cat that came in, horrible dental disease, was diabetic, and had to have full mouth extractions because the teeth were so bad, having trouble eating, which was affecting the diabetes and diabetes management. Of course, diabetes, dental disease leads to bacteria, which is hard to control the diabetes. So we had to make some choices. They didn't want to do the echocardiogram for whatever reasons. And you're welcome for the OcuGlow. Yep, it's a good product. And so, we had to tweak our anesthesia, and we did fine. The cat did fine. We did the full mouth extractions. It was eating within a few days. And, so we had to make those decisions. But, the cardiac thing in cats is really important. Or any cat that comes in and it just ain't doing right, not really sure what it is. That cardiac test is a real game changer. Not expensive. I think at my clinic it costs like $64 to do that test, and we do it right there. So it's totally, totally worth it. Dogs, a lot of times you can hear the murmur. A lot of small dogs, poodles, will get mitral valve issues. And so if we detect a cardiac murmur on any of our patients, any age, but certainly as seniors, then that will start our cardiac algorithm recommendations. So we have 14 of you guys here. I have 7 likes. Everybody like it so that we can share it. So YouTube will share it with people, because people always tell me that the information was good and why don't more people join, which I know Wednesday at 1 is weird, but that's just the time that I have off work. So anyway, so the cardiac algorithm, if we detect a heart murmur in your dog, the first thing that we are obviously going to recommend is imaging. X-rays are good. Echocardiogram is better. That will allow us to stage. So there's different stages of heart disease. So you have A, B, and C. And then B is like, it breaks into two, like actually it's 1, 2, and 3. And then it's like 2A, 2B, 2C. And so anyway, you stage the heart disease, and depending on what stage it is, it's going to dictate what medications they're going to be on. And so a lot of times if we just detect a heart murmur, we're going to recommend they be on a medication called pemobendin to help preserve the heart function. If we do x-rays and we do measurements, or we do an echocardiogram and we do measurements, and there's fluid retention, and we're going to call that congestive heart failure, they may need to go on additional medications. And then with heart failure, unfortunately, it's a progressive disease. And so those things will be monitored and adjusted over time. And so detecting a heart murmur and addressing that early on and getting on some of the prophylactic medications can really help extend your pet's life and make it easier for them to have anesthesias and the procedures and things that they need to address some of these age-related conditions. So heart is next. Then we go into the abdomen. Depending on the size of the dog, it can be easy or hard. Cats are a little bit easier. We can feel the kidneys. We can see if they're enlarged. Again, that blood work will help us determine their kidney function in conjunction with an enlarged kidney. That's going to help us stage their kidney disease if they have that. All cats at some point, if they live long enough, are going to outlive their kidneys. That's just the way that it is. And so that's why very important, and go over that in Ed's favorite book, why it is very important that with cats, we're really paying attention to the mineral and the protein content, and really staying on top of that, because cats will outlive their kidneys if you guys are doing a good job and getting them to that age. And so we need to be prophylactic about that. So you can feel cat kidneys, but abdomen in the dog, unless we feel like a giant tumor or something, it's not as easy. And then we get to the back end, and what we're looking at in the back end, again, there's more lymph nodes there, but we're looking at their hips and their knees. Do the knees bow out? Do they have some osteoarthritis that we can feel? And if we feel osteoarthritis and we're looking at their general posture and their general stance, do they sit and kick a leg out to the left or the right? A lot of people are like, oh, they're so cute. Look at them. They sit like a lady. They kick their legs out to the left. No, that's usually an indication of knee disease when they do that. And so, do they have abnormal postures? Do they walk like a lady in a pencil skirt like this? That's usually some issues with hips. Do we feel that thickening there? And so if we do that, there are medications available. There are different supplements. I have a whole supplement video that you guys can check out on the supplements that we recommend for their seniors. We recommend acupuncture, chiropractic, electroacupuncture, physical therapy, herbal remedies at my clinic as well. So we'll incorporate all those things. Of course, weight loss. If your pet is overweight or obese, we're going to recommend a weight loss plan for them if they're a senior, to help with their joint health. But one of the most important things that I really stress with people is you have to get the x-rays. You have to get the x-rays, because if you have a senior pet, I cannot tell you the number of people that just assume that their dog has hip dysplasia, because that's a really common thing, and everybody knows about hip dysplasia, and the labs get hip dysplasia, and the German Shepherds get hip dysplasia, but they get other things too. And we need to make sure that it's not bone cancer. We need to make sure that it's not just osteoarthritis. Hip dysplasia is a very specific disease. Sometimes that is a surgical disease. Surgical requires surgery to correct it, where osteoarthritis may be a different picture. And so we have to get that diagnosis. I was just chatting with someone on email the other day through my website, and they were trying to pick between two diets, and one was a weight loss diet that was also a mobility. They were trying to pick between Hill's metabolic mobility and Purina OM because their pet needed to lose weight. And I said, well, you have to get the diagnosis first, because if your pet has two diagnoses, obesity and osteoarthritis mobility impairment, they've been diagnosed with that. We've done x-rays. We know they have OA, or we know that they have a joint problem. Then you go on the mobility one. If they don't have a joint problem, then maybe you're just going to go with the weight loss one. So you have to have that diagnosis, and no vet wants to practice based on assumptions, because it's not good for anybody, because then we always get blamed at the end. Because we always get blamed. You said my cat had XYZ and they didn't. And then the part that people leave out is, but I also declined all the diagnostics, and all I let you do was look at my pet for 15 minutes. It's like, you have to do it. If you want the most out of your vet, you have to let them do the things. I always tell people it's DVM, not GOD. Like, I don't have the X-ray vision, superhero Marvel comic like situation, DC Comics. I don't have that. So I can do better for you if you let me do more of the diagnostics that I need to tailor your pet's treatment plan. So that's when we get to like the osteoarthritis, and then that's it. That's the end of the physical exam. I couldn't, without the blood work, I can't. Hey, Cassandra, I can't tell you. I can't tell you how your dog's kidneys are doing. I can't tell you if your dog has elevated lipid levels. I can't tell you if they're anemic. I can't tell you. I mean, I can see if they're really bad, like if their pack cell volume is 10, they're going to look white, but I can't tell you when it's like 30 or 25. I'm not going to be able to tell that without the blood work. I'm not going to tell you your kidney function. Not going to be able to tell you if they have elevated white blood cells for parasites. I can't have to have that information to get all the other pictures other what I just explained to you that I'm looking for on my physical exam. So that's kind of like the major stuff with seniors. And so a lot of you guys asked me about diet. So you can see we can use diet a lot to kind of help with these things, but it's a way bigger picture. Like the diet is just like a little tiny piece in everything that we have to do. After we do the physical exam, hopefully after we've done the blood work, we're going to make some recommendations for vaccines. A lot of people come to me and say, well, my dog is really old, I don't want to vaccinate them anymore. It's actually maybe even the opposite. As they get older, immune system gets worse. They need those boosters for it to keep. If you are concerned and you kind of one of those people who like want to shy away from it, then you have to do the titers. You can't just say, I'm not going to do anything at all. Like, I'm afraid to do vaccines on my dog. They're really old. I don't think that they need them. Well, then you need to do the titer so that we actually know if they need them or not. Otherwise, it's just a guess. So we offer titers. In those cases, most people don't want to do them because they're far more expensive than the vaccines themselves. So it is cheaper to boost them. And vaccine reaction rates are so minuscule that, that's, you guys have to factor that in. Is it worth it to you personally? As a veterinarian, I don't medically ever, I'm not going to say never, but it's case by case, but most of the time I'm going to recommend that they get the vaccines if you can't afford the titers. Opted for the CT scan to get more info on my dog's soft tissue sarcoma. It gave me so much info on his arthritis. Yeah, and now you can factor that in, get some supplements, maybe get some herbals, PT, maybe you can do some Adequan. You've got a lot more options now that you know what you're dealing with. Are titers accurate? So this is what I'm going to say about titers, and it's a good question. And this is a conversation I have with my clients that ask me about titers. I offer them because people ask for them, and I want to have some information versus no information. If I vaccinate your pet, we know based on the data from the company how long that vaccine is basically certified to last, right? 1 year, 3 years, 2 years, depending on what manufacturer your veterinarian uses. If you do a titer, yes, you need to use a company that is valid. There are some crappy companies out there. We either send it to our major reference lab, which is IDEX or Antec, or they just did a paper a couple years ago, a research publication on a company called BaxiCheck, and I read the data in the literature, and they have very good numbers. And so we will also now, because it's cheaper, run the BaxiCheck. And so I would say those companies have very accurate. But this is the deal with the titer. When you check a titer, it is where your pet's immunity is that day, right? There is no guarantee that immunity is going to last 5 days, 10 days, 3 months, 6 years, 10 years. Whereas with the vaccine, we know that it's going to last X number of years. So if you get a distemper and I vaccinate you, then your dog is good for 3 years. They're not going to get another distemper again for 3 years. We feel really good about that. If you do titers, you're doing titers every year. You have to do them every year, and we don't even know they last the whole year. So a lot of boarding facilities aren't going to accept that. Rabies, that's never accepted. We don't do rabies titers. By law, you have to have that one. So that's kind of the trade-off that you get with titers. You really don't know how long it's just a snapshot in time. You don't know how long your dog is going to be above the titer. The vaccine companies don't have that data to share. So yeah, so with the cancer situation, work with your oncologist. My experience with dogs that have cancer, unless they're on chemo or radiation, they're going to recommend vaccines. They're going to recommend you stay on your preventions, and they're going to recommend you keep up with your vaccines. They're not going to tell you not to vaccinate. The only conditions that I tell people, and that I've seen my local university tell people not to vaccinate, are dogs that are on chemo or radiation, and the vaccines will start after that process is done, or they have an immune condition like IMHA or some sort of immune-mediated ITP, something like that, where they're on immunosuppressive medication. So we don't want to stimulate the immune system because we're already trying to, actively suppress it. Or they've had, not even a vaccine reaction, because now we know that if your pet has had a vaccine reaction, if it's been like a major one, we may not do it. But if it's just like a minor one, like they just had a little facial swelling or something, we'll pre-med them before, and then they're safe to vaccinate after that. There's no issue. Speaking of the C word, how concerned should you be with skin tags? You need to get them diagnosed and see if they're actually tags. Too many people come in and call things skin tags, and they're actually mast cell tumors or soft tissue sarcomas. So a skin tag is not concerning, but you have to actually be sure that it's a skin tag. Yeah, so ask your oncologist. They probably are going to want you to do vaccines still, but you could always do titers as well. So maybe run that by them. Most general practitioners are going to defer to the oncologist if they're one of their patients is seeing both services. So yeah, that's pretty much everything I think I wanted to say about seniors. Because we hit all the high points. We hit the whole physical exam. We hit the blood work. We hit diet and proper weight management. Obviously, making sure that we do everything we can to know more about our pets' health versus getting lazy in our senior pets' days. You actually have to do more for your senior than you do for like just your regular adult. So it's like a bell curve. Like when they're a puppy, they need a lot of help, and then it goes up, and then like, yeah, we don't need, that much. And then as it goes down, we need more help again when we're down here. So that's kind of like the curve of things. So yeah. Any other questions before we wrap it up here? Did a good 47 minutes of chatting. Let me run through the comments just to make sure I didn't miss any. No, I don't think I did. I'll be sure to link, I'll try to tag the OcuGlow in the description box. I will tag maybe VaxiCheck, if I can tag VaxiCheck, and then I'll tag the supplement and the dental videos as well. Yeah, they're gonna always recommend an FNA. Yep, that's what you have to do. You have to do that. There's no way. If you guys have seen those memes, I see them. I get them because I'm a veterinarian. We're like, can you tell me what it is? I'm like, nope, I can't tell you. I can tell you what it looks like. I can tell you what it feels like, but I can't tell you what it is. So yeah, you got to do the biopsy. More information is always better. And you don't want to delay, especially again when you're seniors. You don't want to wait until that tumor is, the size of a basketball, and then ask your vet to do a miracle there. That's definitely going to increase your complication rate. Okay, guys. Well, I hope you had a happy, perfect Wednesday on National Cat Day. We'll have the live. I'll try to take some snippets from it and turn them into shorts and stuff for people that didn't join us and didn't want to. Weren't able to come. It'll be available on replay, and if everybody could just like before they leave, that would be awesome. And I'm gonna try to do this more often and give you guys a heads up when it's gonna happen, but these seem to be fun. Yeah, no problem. And yeah, I guess that's it. I'm gonna end. Bye.